I'm Wendy Ellis, the Director of the Building Community Resilience Collaborative and Networks at the George Washington University Milken Institute School of Public Health. The Building Community Resilience Collaborative and Networks, or as we call it, BCR, are really regional networks of individuals from healthcare, from public health, from education, law enforcement, and other disciplines that are really focused on what we call the pair of ACEs. And that's adverse childhood experiences in the context of adverse community environments. So it's not enough to think about just the traumas that individuals are experiencing, whether those are children, whether those are parents and individuals in our communities, but to think about that community context, those adverse community environments that sometimes actually contribute to the individual adversities that individuals experience, whether that's divorce, whether that's physical or mental abuse, or physical abuse, or parental separation, discourse in the household, financial stresses, and even thinking about some of those issues such as food insecurity, housing stability, violence in the community. And so pulling together a multidisciplinary approach to this work helps us to not think about just those interventions at the individual level, but what from a systems perspective are we doing to build healthier, more supportive environments for our children and families so that we are not only healing individuals, but we're actually putting into place the supports and buffers that support resilience as well as equity. So when we talk about adverse childhood experiences, we understand that the science behind what actually happens to individuals is very complex. Understanding that physiological and biological response to these constant stressors. And many of you may be familiar with the term of toxic stress. So that means that it's chronic and it's unrelenting without access to the buffers that would actually help to alleviate those stressors. So even understanding the pathways of both what's happening at the individual biologic level, as well as what's happening with regard to understanding the chronic stressors that are external to that individual, there's a lot of complexity there. And so one of the ways that we were thinking when I began doing the BCR work is how do we take these very complex issues and distill them to something simple that people not only understand the issue at hand, but they can begin to see themselves in the work, activate networks to begin to address these issues. And so I thought of a tree. Because when we're walking down a street and we can look at a tree, if we're in a park, you can look at a tree, you look at the branches and the leaves on that tree, and you begin to assess the health of that tree, or whether or not you would let your child climb up that tree if the branches are sturdy and strong, as opposed to a tree where perhaps the leaves are withering. Well, much like adverse childhood experiences, whether you're in a clinical environment or in a schoolroom, you can begin to understand or assess the health of an individual by whether that child can sit still in a classroom if they're easily agitated, or perhaps the child that sits in the back of the room is very withdrawn. Something's going on there. There's not a normal behavior there. Or perhaps if you're a clinician and you're sitting with a mother who has her newborn, but she's not attached. She's not making eye contact. She's not nurturing. Is that a symptom of maternal depression or some other discord that is going on in the household? Those things we can begin to assess by merely looking at individuals and perhaps interacting with them. But what isn't so readily accessible, just like that tree in the park, is what are those nutrients in the soil that actually are feeding the outcomes that we see? So with that mother, what is the context in which this disconnect appears to be occurring? Is it that there's an issue with regard to food insecurity? Are they sleeping on a couch tonight? Was there some sort of discord within the home between their intimate partner, some sort of violence that's going on? Or is there a history of trauma herself that prevents her from connecting with her child? And so that begins to help us to think about that tree, that image, helps us to think about the root causes. What's feeding the outcomes that we see? And by doing so, not only does it expand our thinking about the context, but it also lays out very clearly the role for other sectors. So when I talked about housing insecurity and food insecurity, we begin to think about those partners that should be at the table to address this, not just at the individual level, but really from a systems perspective. So do we have our housing partners at the table? With regard to community violence, do we have law enforcement, but also social services working more collaboratively together? Are we working with our returning citizens in a way that perhaps that stabilizes households because we're able to ensure household stability and being able to have some level of home security in the sense of like we have a safe place to go to? Access to economic mobility is a lot of times really at the root of so many of the issues that I just described. And so do we have that sector, those that can drive, whether that's retail, or whether that's job training, the access to those levers that help families move up the economic ladder to stabilize households. So that looking at that simple tree, that simple graphic, helps to also distill this very complex systems thinking into two simple issues. What's the problem that we're trying to solve, and what's your role in helping us come to a solution? So at the heart of the work that I do is really activating communities to address those issues, the pair of ACEs, the adverse childhood experiences in the context of adverse community environments. Fostering innovation by fostering collaboration across multiple disciplines, across multiple sectors. Accessing the opportunities for collaboration, whether that be in small p policy or big P policy. Along the way, we recognize there are barriers, and sometimes those are systematic barriers. Sometimes those are barriers that are actually policy-driven barriers. And so having this larger group, this larger network of policy and advocacy to help not only inform the work that we're doing on the ground from whatever legislation and opportunities that we are able to create with policymakers, but also it's a necessary bidirectional conversation. Taking the real time, efforts, and lessons learned from the field and using that as data and evidence to inform policy is very important as well. And so having an organization like CTIPP, like the Campaign for Trauma-Informed Policy and Practice, to really be those boots on the ground, not only in community, but also on the Hill, which can be very intimidating for many. And that's also a very important role for this organization as well, is to be able to activate these networks and help communities recognize their role, their power, their voice in being very strong and being very credible advocates for these policies up on the Hill. So I think that having this collective body, the wisdom of not just those individuals who are trained as policy and advocacy, whether you're an attorney or whether this is the work that you've been doing for your career, understanding that also we can marry that with the wisdom of the experience and the work that's going on the ground to be this dynamic force, and a force for good and a force for change, and being able to point to specific outcomes that we've been able to achieve by working in such a synergistic way with policymakers as well as with community is absolutely vital. So for an organization like CTIPP to be here and serving both and the understanding that this is an organization that's become very vital to many policymakers in understanding how we take these lessons learned from our communities and translate that into policy is really vital. Now, ideally, we would have supports, we would have tons of resources to support this. But the truth of the matter is, just like most advocacy organizations, it's grassroots. And that means that we survive as an organization, as a force for good, by donations. And what would those donations support? Well, they would support staff that actually help us do the critical analysis, the policy analysis, as well as analyzing the evidence of what's going on the ground so that we can take that back to the Hill and really be even stronger advocates. And we're not talking about having lush offices and having, having assistants here. We're talking about really the nitty-gritty of this work. And part of that is through your support. So this is why CTIPP really does need the support of those advocates and of our community members to not just write a check, but also to be there in force. and really sharing the information back and forth. So of course, yes, a check will help and a check will keep us going, and it's absolutely vital, but we also need your involvement on the ground to keep this work going. CTIPP plays a very vital role in taking voices and taking lived experience and lifting that up. And why is this important when we talk about policy with lawmakers? It's because it's this lived experience that is really universal. As the data bear out, adverse childhood experiences and these traumas are truly an American issue. Yet this is one of those American issues that we keep under the rug. We don't share this. And what we've learned in the last 4 years and working together in this collaborative fashion is that by talking about this, individuals, particularly policymakers, have begun to see their own trauma histories, whether that's through their own personal experience or the experience of family members. And being able to have those community voices, that lived experience, come and literally have these sit down face to face with our lawmakers to remind them when we're not talking about some just unidentifiable or faceless individual, but we are literally talking about each other. We're talking about your uncle, we're talking about your father, we're talking about your mother, your sister, your brother. That has been so powerful in this work, giving voice and giving a face to what has been faceless and also nameless, and normalizing the conversation with regard to trauma. Because if we don't normalize this conversation, we will never be able to solve this issue. And solving this issue is at the heart of so many of the chronic disease and other issues in our communities that we absolutely have to solve if we're going to move forward. So the voice of community is not something that is an add-on, is an afterthought, is brought on to make our lawmakers cry. It's actually to humanize this issue and really bring us all together to understand trauma is not about those people, it's about all of us.